Hello, my name is Nora Clark. Today I will be doing assessment of the heart sounds. I have my client here. I'm going to get permission from her to do this video and get her to introduce herself with her name and date of birth.
My name is Kiosha Myers and my birthday is April 16, 2002.
Do you get permission for me to do this recording?
Yes, ma'am.
Okay. First thing I'm going to do is get a little family history from you. Do you know if your family have any cardiovascular problems?
My mother did when she was pregnant.
Okay. Do you know what she had?
No.
No. Okay. Do anybody in your family smoke or drink?
Um,
Um, do do you know if anybody else have any heart problems?
no.
No. Okay. And do y'all try to eat a fairly healthy diet?
Yes.
Okay. That's good. Do you yourself, do you have any heart problems?
No, ma'am.
No. Okay. Any headache, shortness of breath, or dizziness, chest pain today?
No.
No. Okay. No pain. Okay. That's my subjective data. So now we'll gain my objective data by doing my assessment of her heart sound. I'm gonna wash my hands before the video. Make sure you wash your hands before coming in contact with any client, and make sure you explain to them what you're doing before you touch them and get permission to touch them. Okay. Is it okay for me to listen to your heart sound? Okay, just so you know, I'll be asking you to move your breast tissue because I may not be able to get to the area I need to hear. So just don't feel uncomfortable with that. Okay. And guys, I have a recliner here. If we was in a hospital bed, of course we would raise the bed up to our level and won't be bending over so much. But I'm gonna recline my patient right now. Okay. And first I would be inspecting. I'm gonna get down to her level and just look for that apical impulse. It will be in the mitral area, which is gonna be the fifth intercostal space, and mid-clavicular line. So I would look for a pulsation or something there. And sometimes you may not see that in a heavier patient, but the thinner patients, you may see that impulse there. And after my inspection, I would palpate with the palmar area, and I would just palpate each area of the heart where you would listen, and I would be palpating for like thrills or any abnormal feelings there, and I don't feel any right now. And just so you'll know before I start assessing, if you have trouble locating the sites, you can start at the sternal notch and just count down from the ribs, and between that second and third rib, it's gonna be your second intercostal space. That's where you would start your auscultation. And in between each, you just count down each rib, and each area gonna be your intercostal space that you need to listen to. So, a phrase to help you remember, you can remember apes to men. Just using that first initial apes to men to give you the aortic, pneumonic, Erb's point, the tricuspid, and the mitral area. Or you can use all pigs eats too much. I like that one. But I'm gonna go ahead and listen. I would listen to the heart sounds with the diaphragm of my stethoscope, making sure that I have my opening closed turn to the right side where I can hear. You can test your stethoscope with a little tap. And I'm gonna listen in the aortic area, second intercostal space, right sternal border. The pneumonic area, second intercostal space, left sternal border. The Erb's point, third intercostal space. Then you kind of go down to the fifth to hear the tricuspid the fifth intercostal space near the sternal border. Then I'm gonna ask you, can you lift your breast tissue up? I'm gonna listen to the mitral area. It's also in the fifth intercostal space, it's mid-clavicular line. This site here is gonna be the area where you hear the S1 sound the loudest, and the S2 sound is gonna be heard loudest at the base, the second intercostal space, the aortic and pneumonic area. And if you just pay attention, the apex of the heart is the tip of the heart, and the base is at the top of the heart. Now I'm gonna listen for my heart murmurs, and I will use the bell and make sure I'm turning my opening to the right side. And I will just listen to each area there, listening for any murmurs or extra heart sounds. You lift your breast tissue up again. And if there were S3 or S4 sounds, they're heard loudest at this apex. And you can also ask your patient to turn to the left side. Can you turn to the left side? Okay. This would make it a little easier if the sounds were there to hear it, because it brings the heart a little closer to the chest wall. And also, while she's on this side, it's kind of out of sequence, but just because she's still on the left side, I didn't palpate for the point of maximum impulse, but the same area is where you would palpate for your point of maximum impulse. That's that little pulsation that you feel. I feel that. Okay. You can turn back. All right. That's my assessment of my heart sounds. Her heart rate was regular and rhythm was regular. No, it wasn't tachy or anything like that. And I didn't hear any extra heart sounds or heart murmurs. And come back to the sitting position. Do you have any questions about your heart assessment?
No, ma'am.
No? Okay. Just some special things y'all may want to know. I told you about that S1. The S1 is going to be the closure of the AV valves. That's going to be the mitral and the tricuspid valve. That's going to give you that S1 sound. The S2 is going to be closure of the semilunar valves. This is going to be the pneumonic and aortic valves. Sometimes you may hear a splitting of the S2. It's like when the patient breathes in deep and the changing at thoracic pressure is noted. And the valves can close, like one close a little bit before the other, and you may hear a splitting S2 sounds. And as you've seen in the video, I did do the inspection, the palpation, and auscultation. Percussion is really not done much of the heart. And just so you can refer back to the murmurs, if you look in your Jarvis 7th edition book, Physical Exam and Health Assessment, it has chapter 9, page 44. It talks about the grading of the heart murmurs. And anything else with the extra heart sounds, you also can refer to that chapter 19 in your book. Just so we know, older adults, you may hear that S3 or S4 sound in older adults, but it doesn't necessarily mean that they have cardiovascular problems. And when we're talking about listening to the site of where you would listen for the heart sounds, is a little different in children. And an infant that the apical pulse, where in a normal adult is the 5th intercostal space, mid-clavicular line. In an infant, it's going to be 4th intercostal space, and it's going to be lateral of the mid-clavicular line. In a child, from age probably 1 to 4, the site is gonna be fourth intercostal space, and it's mid-clavicular, but it's a little left of the mid-clavicular line. And age 4 to 6, it's gonna be the fourth intercostal space, mid-clavicular line. And once the child is about 7 on up, it'll be that normal space, fifth intercostal space, mid-clavicular line. Just so you know, I know you heard all that too. Some things you can do to help prevent cardiovascular problems. You can exercise. I suggest maybe exercising 3 to 5 days, about 3 to 5 days a week, about 30 minutes a day. You want to watch your weight because obesity can contribute to heart disease. You also want to watch your diet. You don't want to have a lot of fried foods, baked foods, or pan-seared or grilled are going to be your best choices with vegetables, and kind of limit your starches too. And also, you want to not have foods high in sodium, so you don't want to eat a lot of fast food either. And smoking and drinking, they're not good for your cardiovascular health. Do you have any questions about anything? Nothing? Okay. Well, I thank you so much for the video, and that's all. Thank y'all.